You got a man bun, Paul?
Yes, I do. And I'm using my my daughter's elastic band. So needless to say, I just got tired of it going in my eyes.
Yeah,
While
fair
I'm
enough.
working out, and so here I am.
I told him it goes with the whole hipster theme for the week.
It
Well,
does. That's true.
There it is.
Love it. All right. Okay. I guess we can go ahead and get started. So hi, everybody. Welcome to our discussion. This week, our theme is, Are You Hip to Your Hips? I've just wanted to let everyone know that you are automatically on mute when you enter the room. But if you wanted to join the discussion, and we hope that you do, just go ahead and unmute yourself. And then we are also recording this session as well. So if you prefer, you're welcome to leave your camera off. All right. Okay, so I guess we're going to get started with a bit of a discussion about the anatomy, movement, and function of the hips. All right. So Martin, would you like to take it away?
Yeah, sure. So when we talk about the hip, it can be a little confusing as to what the hip actually consists of. So kind of like when we talked about the shoulder a couple of weeks ago, the shoulder joint is a ball and socket connection between the humerus and the scapula. And it's surrounded by a number of different structures, muscles, ligaments, and connecting moving parts and all that. And that's what makes up the shoulder girdle. Similar thing happens with the hip. Again, it's a ball and socket joint. The hip joint is the connection between the femur, so the thigh bone and the hip bone. And then in addition to the hip bone, you have the sacrum and coccyx, and all that is what makes up the pelvic girdle. Okay, so it sounds complicated just because of the interchangeable terminology that gets thrown around a lot of the times. But the interesting thing about the pelvis is that even though it looks like it's one giant bone, right? It's actually two separate halves. And so this is what plays a role in different biomechanic restricted movements and then muscular imbalances in the body that we see as massage therapists. So the primary function of the pelvis is pretty much to support the upper body and transfer body weight into the legs. So sometimes because of these muscular imbalances, you can develop instances where one side of that hip, one side of the pelvis is actually rotated more inward, or it's rotated more anteriorly, posteriorly. And this is what causes like a cascade of different muscular issues from the waist down.
Before you continue, so how are those bones connected? Is this muscular or is it?
So they're connected by, the hip is actually three separate bones. Okay. So instead of a muscle that is attached by a tendon, these are just muscles or bones attaching to bone. All right. So
can you guys see the screen?
Yeah.
Yeah.
So, all right. And then, so as massage therapists, we can't adjust these articulations of the bones like chiropractors can. But what we could do is work on releasing the muscles that are responsible for pulling these bones out of alignment. So yeah, if you look at the anatomy of the hip, you can see how complicated it gets with, especially if you bring up the layers of muscle that kind of just lay one on top of the other. And there's different muscle fibers firing in all different directions. So it's kind of complicated as far as to what muscle causes what movement. And then as soon as you can narrow down what muscle is affected or what movement is restricted, you can attack that specific muscle group. So if you look at the picture there, you're looking at the posterior side. So that big giant muscle group on the left-hand side there, those are your glutes. And you take a look at the big glute max, which is pretty much your entire butt cheek. And then you see the different like layers of it. So there's a lot of stuff going on that's responsible for different movements. And the movements themselves are demonstrated down further in the article So you have that Dennis demonstrates, you have, flexion, extension, abduction, adduction, and then medial and external rotation. So any kind of movement with the leg itself, it's generated from that hip joint.
Okay.
So this is abduction and adduction that is performing now?
Adduction, moving the leg inward towards the middle. Second pair is flexion, which is moving the leg towards the hip. Extension is moving the leg away from the hip in a backward kicking motion. Lastly is lateral rotation, where you're moving the leg outward at the thigh.
And so you recommend doing this on a regular basis then?
Well, no, he's just demonstrating the movements of the hip. So each one of those 6 movements that he was doing, there's a certain muscle responsible for that, or muscles responsible for that movement.
Got it. So it's more of like, is it more of an evaluation to see if you have imbalance one way or the other, if you have pain doing those movements? Yeah,
so there's a number of different syndromes. There's a number of different tests to perform different syndromes. It's all about diagnosing and testing which areas to really focus on. So a couple of the major ones that we see from a massage therapy standpoint are people who come in with SI joint pain, people who come in with like psoas, tight hip flexors, and then also another one is
SI joint. Where is this again? Sorry. And
so your SI joint is your sacroiliac joint. So your sacrum is that upside down triangle. Yep, on the bottom of your spine. So it's pretty much it limits the force between the hip and the lumbar spine. So it's a kind of like a transition area for shock absorption when you're walking or running or whatever. And the thing is, it's not supposed to move, right? It's a joint that's not supposed to move. Mm-hmm. But due to certain things like a trauma or an accident or bad posture over time, pregnant women, sometimes this joint will actually become weaker. And then that's when, there's different strengthening and mobilization techniques to help realign it per se.
Got it.
And then another one that we see a lot of is like psoas tightness, and then we're going to get into the anterior pelvic tilt.
So and psoas, okay, that's
it's like a deep core muscle.
Mm-hmm.
Just excuse my diagram.
Perfect. I can follow.
You can follow. Good.
So this is due to you say you had just pain in the psoas. Like what's the symptom that you see?
So a lot of times the psoas pain will kind of show itself elsewhere. There's ways to test for hip flexor tightness. One is just a visual test. So I know we've had you do this before, where you just look at the person standing from the side and see how their pelvis tilts. If you have that anterior tilt, that's one way, just a quick visual test. If you don't have time to do something, it's called a Thomas test. So with the Thomas test, what you do is you lay on a table, like a massage table or a bed, and what you would do is you hang the lower half of your body off the edge of the table. You bring one knee up to your chest, and that opposite leg is what you're looking at. If that opposite leg, yep, perfect. If that opposite leg starts to come off the table, that's showing you have a tight hip flexor. That's showing that you might have an anterior pelvic tilt. And then looking at the lower leg, the shin, if that shin isn't 90 degrees down, what that's saying is that quadricep muscle. So the quadriceps and the psoas are two different muscle groups, but that's one way to kind of differentiate. Are you having psoas pain, or are you having just quadricep tightness? Gotcha. And those are just general tests. I mean, they're just, you're never don't know for sure. They're just regular tests.
Okay, that makes sense to me. And so, okay, so continue, and then I'm gonna ask more questions. And by the way, folks, if you want to ask questions, you can also feel free to, if you don't want to raise your voice, or if I'm talking too much, you can always use the chat to ask your questions. We'll monitor this. If you have questions, happy to answer. I mean, I'm not going to answer them, but I'll monitor the chat.
Yeah, so with the anterior pelvic tilt situation, and I know we touched on this briefly with, I think it was the low back pain webinar. So
Right.
if you picture your hips as like a bowl, right? An anterior pelvic tilt would be as if you poured water, picture pouring water out of the bowl, all right?
Okay.
So this is mainly due to the muscles in the front of the hip being too short, whereas the muscles in the back of the hip are being outstretched and weak. So in this case, it would be tight psoas muscles and weak glute muscles, okay? So that gives us an idea of what needs to get released, and then what we have to give as far as outtake to the therapist or the client as to what they need to focus on with strengthening.
Okay. And speaking of which, so what do you actually recommend, and how, I mean, how would you address this type of, tightness?
So, I mean, what you would do is, I mean, there's different stretches that you can do to address tight hip flexors, both that can be done with a massage therapist and at home. Okay. So one is just like a runner's lunge position. I know there's a video towards the bottom of Joey's demonstration there, and that's what you're gonna wanna stretch out. And then also up top, as far as strengthening the muscles, usually the glutes are the culprit here. They're the ones that are weaker, outstretched, that needs to be focused on. And so he also demos a bunch of really short and quick but effective exercises to strengthen the glutes. Okay.
And so is it like a syndrome of like sitting too much down, for instance? Is that one of the reasons why our glutes are so weak?
Yeah. So when you're sitting, pretty much your butt turns off. Your glutes are shut down. They're not working, and your hips are in this flexed position. So if they're constantly short, the muscles will adapt. They actually adapt and will stay short like that. Okay. So that's why you got to stretch them.
And so this type of imbalance, so you said that you don't necessarily notice it in the hip themselves, but what kind of type of injury does that can that lead to typically?
So if you're doing things like, what that's doing too is the anterior pelvic tilt, that's putting a lot of compression on the low back as well. Okay. So if you have an anterior pelvic tilt, then you go to do something like lift up something the wrong way, your muscles in your low back can spasm and cause a disc herniation and other things as well.
So low back pain, and then it's like anybody in your clientele, in athletes and things like this, is just mainly, are you going to mainly see problem in the back? Are you going to see like maybe loss of power or something along those lines? What do you?
Yeah, you usually see from an athletic standpoint, you see a lot of decreased power output in whatever it is that they're doing. So I mean, if you're doing things like squats, for example, and if you're not activating your glutes, you're not seeing the numbers that you want to see.
How do you not activate your glutes if you're doing a squat?
Well, you're activating them, but you're not using them to their potential, is what I'm saying.
Okay.
Yeah, there's a difference between activating a muscle and having a strong muscle. There's a difference, but
Yeah.
just like you wouldn't be able to like swing your leg back in like a walking or running position if your glutes weren't activated. But if they were stronger, you can get more of that hip extension and more of that driving force and potentially go faster.
And selfishly, you know, as a runner, so what would you recommend in terms of you know, making sure that I address the strengths of my glutes? Like, is it you know, doing this exercise that you guys were saying? If so, how much, how often is it, you know, doing more like maybe heel workouts and stuff like this? What do you usually recommend?
Well, I mean, you even said yourself that you sit a lot during the day, so that would probably mean to pay a little more attention as to how many days you're doing posterior chain work. So things like hip extensions.
And the hip extensions are what are the one, like, what are those?
Yeah, so if you like just stay standard like that, and if you were to have something resisted around your ankle and just swinging your leg back, you know, so, or if you're in a plank position,
like,
so it's the backward motion that we're talking about here.
So it's like the thing. So if, like, just again, like, to make sure I understand, it's this, right? The one where I'm swinging back like this. Can you see me? Like,
no.
Can you see me now?
Yep.
It's like this, right? This one?
Yep, so that activates the glutes.
Okay.
Another one is if you straighten your legs too, come into a plank, just a full plank, and just raising one leg up off and just holding it there. Yep. So that's, I mean, that's activating the glutes. So that's like anything that's going to take the leg back like that.
And yeah, so nothing to do with heel workouts then.
So I mean, hill workouts are great. If you're going uphill, you're going to be working more of the hamstrings. If you're going downhill, you're stabilizing the quads and the knees. But that doesn't necessarily mean that's going to fix your anterior pelvic tilt by doing more or less hill work.
I don't know why I thought this. I don't know. Maybe it's because, I don't know. I guess it's a misconception. But all right. So I'll have to swing my leg up and down. That's fine. It's perfectly fine. And I mean, truthfully, like, if it's a matter of generating less power, then I'm interested. You know what I mean? So
yeah, absolutely. Like, I mean, we've seen it firsthand. People who come in and you know, who have these symptoms of low back pain or glute pain, or what they think is piriformis pain, and when they go and actually work on strengthening the tissues, the muscles around that posterior area, like the butt, the glutes, and then they go back to doing whatever they were doing, it's, some of the stories are just remarkable. It's like people coming in here, it's like saying, I mean, I actually know what it feels like to use my ass when I run. You know, it's like a different feeling. It's much more smoother. It's easier to just move.
Right. And
like if you ever watch like these Kenyans who run, it's just everything is so smooth because everything is so in balance and they're activating every possible muscle fiber that they can.
Absolutely.
You know.
Yeah, for sure. They make it look easy, I suppose. While running at a 4-minute mile for 26 mile, but yeah, that's another story. So how often do you recommend, like, on a TP? So I'm assuming that there is this stretching where we can, like, obviously massage can help, but in terms of strengthening, so let's take a typical case, because that there's me, for instance, that spent literally my life in front of a Zoom call for 9 hours a day or something along those lines. And then also make sure that I go right away to run and sit back down, because I was told that's what I was supposed to do, right? That's not, you shouldn't do this, but I'm doing it. No, actually I started kind of walking before going for a run. So, you know, and I'm trying. Okay. So how often do you recommend doing that type of strengthening exercises? Like for a regular person to avoid this kind of issues?
3 days a week, if you're focusing on those specific areas, 3 days a week for an hour will be more than enough time
for an hour. You
Yep.
want me to exercise my glutes for an hour 3 times a week?
It's not only your glutes; it's a lot of surrounding parts. So you're working low back, you're working hamstrings, you're working other areas too. You're not just doing, butt lifts for 60 minutes.
All right. So what would that look like? Because I don't know how you make. So do we have a computation of kind of this exercise? Is that what you were showing earlier, Olivia? Or?
Yeah. So we have. Well, let's go through the rest of. We've kind of focused on the glutes here, but let's.
All right. My bad. So let's continue.
Now I can't find my screen.
There it is.
Oh, sorry. We have someone else in the waiting room here.
No problem.
No, I mean, like things like if you're looking at, weights, so like deadlifts, so glute bridges, and there's a number of different sequences that you can do. If you're doing 3 sets of something, say for 8 to 12 reps, that, with 5 different exercises, that should take you close to an hour.
Fuck, I don't have an hour to do this 3 times a week. Are you kidding me? Okay, fine. Can I do it while I'm on a Zoom call? That's the question. If I can, then come in.
All right, so here's a racy photo we found of the glutes, but that's basically just from a different angle. And then here's a photo that of the psoas. So the psoas major, and then the iliacus, and they're that's similar to my diagram before here. So that's the deep core muscle that we were talking about earlier. Yeah. And then another muscle that you may have heard of is the piriformis. So that's it's deep to the glutes, and it's an external rotator. So that is another one that can cause...
External rotator meaning?
Externally rotates your hip.
So it moves it away? Like it opens it up?
So if you turn your knee to the side, you're externally rotating your hip.
Okay. Just making sure.
Yep.
So like penguins have tight piriformises.
Nice.
Do penguins have piriformises?
Probably not. But if they did, they'd be tight. And then the other muscle group of the hips that we haven't spoken about yet is the adductors. So they're the muscles that kind of attach here on the inside of like the inner hip, and then they kind of fan down towards the inner thigh. Mm-hmm. But yeah, so today we actually have a speaker who is going to talk about her experience with Piriformis Syndrome. So Piriformis Syndrome is also often known as, or it's sciatica. And it's very prominent in runners, but it is also, there are lots of people who, it's a, it can tighten up. A lot of people that have their hips flexed a lot. So a lot of cyclists can have Piriformis Syndrome, and even just a lot of people who are sitting a lot. So again, it's caused from that imbalance between the hip flexors and extensors. So our very own Ilana, our wonderful massage therapist Ilana, is going to be talking about her experience with the syndrome. So welcome, Ilana. Thanks for joining us.
Thank you.
How are you today?
I'm good.
That's good. All right. So I guess the first question would be, when and what was your first symptom of the syndrome?
So my case is a little odd. So my very first experience with it was actually 18 years ago. I was at work, and at the time I was in the military, I was a baker, and I was at a deep sink. And I basically picked something up out of the deep sink and went to turn. And as you turn and step, you know, your leg laterally or externally rotates out. And I felt a sharp pain just for a second, deep in the glute. And, you know, it went away. But then pretty much every time I did that same step with my leg to the side, I got that pain over and over and over. Didn't know what it was though.
Okay.
No idea. And because it was so minor at the time, I pretty much ignored it.
Okay. So when you say minor, so it sounds like it was a sharp pain, but was it just because it wasn't happening very often?
Correct. Yeah,
Okay.
it was a sharp pain. It was like a very sharp kind of stab pain, but it lasted a couple seconds at a time. And it wasn't necessarily like if I'm walking straight, I wouldn't feel it. It was just when I would, you know, take a step with and rotating my leg out to the side like that.
Okay. Okay. And so how long did it take you to figure out what it was? How did you figure it out?
So it took a long time because it actually started to progress. Like I said, because I didn't do anything about it and I didn't really know what it was or why it was happening. It kind of over the years got worse and worse, so that when it flared up, it would hurt nonstop.
Okay.
And it didn't matter if I was sitting, standing, laying down, whatever, the pain did not go away. It was just, it felt like a sharp knife deep in my glute muscle. And I think I probably threw them off because at some point it started switching sides. So it initially started, it presented on my left side. And then at some point, occasionally it would switch to the right side. Paul's like, what?
I'm interested. I'm paying attention.
So I remember there was probably at its absolute worst, I was living on the 3rd floor and it flared up so bad that my friend was like, you need to go to the hospital and figure this out. And it took me an hour to get down my stairs just to get there because it was excruciatingly painful.
Oh my goodness. And then, so what did you do after you were diagnosed with it?
So first with medical diagnosis, the doctor recommended stretching and anti-inflammatories like ibuprofen. For me, I personally don't like to take medication if I don't have to. Plus, with my 4 years in the military, Motrin is the cure-all drug, so my tolerance, I probably had to take 800 milligrams for it to do anything. Not so good on your stomach. So it was a while of just kind of suffering of, trying to stretch it out, not always remembering, because for me, so I have a background, I originally, when I was 2, I started dancing. So that's kind of why I think that it presented for me. For 6
months of lateral rotation.
Yeah, 16 years of that, always having your feet turned out. So that muscle is probably tight a lot. So yeah, it was just, I suffered for a long time. And then it actually wasn't until 2014, when I was rear-ended, that I met a chiropractor who said something to me about, he was treating my neck, but we were talking about it. And he actually mentioned trigger point massage. And so that's the first time that I was like, oh, what's that? Let's go figure that out. So I went and tried that. And I have to tell you, it was probably the most painful thing I've ever experienced. But when I got off the table, I felt amazing. Like I felt like there was an inch in both sides of my SI joint. Like everything just felt super relaxed. And that's kind of been my thing now, is religiously stretching, and at least once a month, trigger point massage.
All right. Wonderful.
Yes,
And-
I think. And so do you still, so it's just stretching, do you do a little bit of strengthening as well for the muscles?
So you can't really strengthen your lateral rotators from my understanding. Feel free to correct me if I'm wrong, guys. You can strengthen the surrounding muscles, but because they're smaller muscles, I think, and they're mostly just control of that one singular movement, I was always told that I couldn't do anything to strengthen it. The only thing I could do was make sure that it was loose.
Yeah, I mean,
Right.
the thing with Piriformis syndrome is the tight muscles impinge the sciatic nerve. So you don't really want to be doing anything that's going to increase any further tightness. You want to be stretching and loosening and lengthening that muscle.
Yeah. And there is actually a very small portion of the population where the sciatic nerve actually runs through your piriformis muscle. So that makes you even more prone.
That makes sense. Well, and did you ever figure out what caused it in the first place? Was just like...
So yeah, like I said, I think just the fact that my years of dancing and using that muscle that way, and then I think when it flared up, I was about 2 years into my military service, so I was running more and wearing combat boots all the time.
Yeah.
So I think it was just something that, you know, my hips were used to doing a certain thing, and now they weren't, and they were being forced to do something else.
Yeah. Yes.
Yeah.
Yeah.
But I can say, you know, if I go a few days with, say, sitting too much or spending too much time standing, then I can kind of tell that it will flare up if I don't take some preventative and stop and stretch more than I normally do.
Right. I suppose this is the same kind of stuff that we talked about last time, where you don't notice it until it's problematic, I suppose.
Right.
Yeah.
Exactly.
Yeah.
And Ilana, what does your routine look like? Would you say you stretch every day or?
No.
No? Okay.
I wish I did, but I'm kind of really bad that I've always associated stretching with physical activity.
Right.
So like, you know, I stretch when I play basketball, or I stretch when I dance, or I stretch when I run. But, you know, if I don't do any of those things in a day, I don't necessarily think about stretching. So ideally, yes, I should be stretching every day. My all-time favorite stretch would be the pigeon pose.
Yep, it's a pretty great one.
Yeah. So yeah, definitely not as much as I should, but.
And are there any things that you do in your like daily activity, or that you notice that will actually provoke it from flaring up again?
To make it flare up or keep it from flaring up?
To make it flare up.
If I'm sitting too much, or maybe like say if I'm sightseeing all day and I'm just like walking around the city constantly, you know, like walk a few blocks and then you're standing here and then you're standing there, that kind of activity will cause it to tighten up.
Okay. Okay. All right. Does anyone have any questions for Ilana?
Ilana, when you were first diagnosed, how did they how did they diagnose? Was it through, did you get a picture taken of it, or was it like a muscle test thing? Or because I know there's different ways of diagnosing sciatica and piriformis syndrome, how they're kind of the same but not.
So That's kind of the long part of the story of it actually took years of me seeing doctor after doctor and everybody kind of just saying it's in your head or, you know, we don't see anything wrong. The time that I did end up going to the emergency room, when it took me an hour to get down my stairs, the doctor just kind of took one look at me, listened to what I told him where the pain was and said, oh, it's sciatica. But at the time, my reference for sciatica was it runs down your leg, and I didn't have that. Mine was very localized. So I was kind of like, yeah, okay, you're the doctor, but I don't quite believe you. It actually wasn't until a couple of years later that I became friends with some triathletes, and one of them had some experience with Piriformis Syndrome, and he was actually a medic in the Navy as well. So he mentioned it to me, and he kind of was like, you know, this is what it sounds like to me. So then I took that to my doctor, and she pretty much just agreed with him. But as far as like testing, anything like that, nothing.
And so how long was it from, you said it's been going on for about 18 years, but how long was it from when you first had that very first stabbing pain to when this happened, when you were diagnosed?
12, 13 years.
Oh my goodness.
Yeah.
Wow. Well, hopefully we'll get better at figuring this out here.
Well, and that's the thing, like I said, like once I figured out trigger point massage and that stretching, I mean, now I can go months without having any flare-ups.
Mm-hmm.
Gotcha.
Good.
Yeah.
Well, thanks for sharing. It sounds painful. So
Sure does. Does anyone else have any questions for Ilana? I feel like a lot of us probably have some experience with, you know, a lot of our clients are very active. Yeah, I personally see a lot of people with Piriformis syndrome. Does anyone else have any stories that they would like to share, or?
I mean, I feel it now, but
Stand up and stretch.
Yeah, pigeon pose, Paul, right now.
I have a story that happened maybe 6 months ago. I was actually cleaning the hall closet on all fours, you know, picking the, you know, here and there things up off the ground. Felt a little pain in the glutes. It's like, ow, stand up, you know, shake it out, go back to it. And this happened for 2 hours. And by the time I was done cleaning the closet, both sides of my glutes spasmed. I felt like I herniated a disc in my back because everything locked up so much. So I understand your pain, Ilana.
Wow, but so you felt it, yours presented more in the back, in your back?
It initially presented in my glutes and it migrated to my back.
Okay, wow. And does that, you said that was about 6 months ago, has it reappeared, or?
It comes and goes, depending on my activity. If I'm very active, it won't happen very often. But, you know, since the lockdown, there's only so many things you can do in the house. I was bending over yesterday picking stuff up and I felt it starting up again. And there's only so many things you can do to get it to go away. Mine is stopping what I'm doing, go for a little walk to stretch the muscles out.
Mm-hmm. Okay.
So it's something that comes and goes on me.
Okay. Okay. And once again, moving is what helps it. And I guess it sounds like you just have to ask someone else to clean that whole closet then.
Yeah, that'd be nice.
makes sense.
Thanks for sharing, Kevin. All right, does anyone, oh wait, there's a message here.
Is there a place for compression for recovery after exercise or just stretching? You want to take this one?
What was the question?
Compression of the glutes and etc. for recovery. What's your thought on it?
So is there a place for compression for recovery after exercise or just stretching?
So thing about compression, if you're, say if it is a tight piriformis muscle, compressing it is going to help release it. But again, that's why I asked Ilana if it was more sciatica based, because if you go and take that muscle into a stretch, you could possibly be doing something to the disc in the low back. But as far as compression, and you know it's piriformis, then yes.
Okay. So I thought that compression, is there actually evidence for that it works? Because I thought it was kind of up in the air at the moment.
It feels good.
Well, I mean, that doesn't mean that it's it's valid. There's a lot of things that feel good. Doesn't mean that there's evidence behind it. So that's kind of what I'm asking. I thought that the jury was kind of out on this particular topic.
So the thing about.
Sorry, Martin, go ahead.
No, go ahead.
I was just going to say, it kind of depends on the type of compression that you're talking about. Because things like trigger point is a type of compression where it's more like a pinpointed compression on a muscle. So it kind of depends on if you're talking about like a full band, like say the sleeve compression, that kind of thing, which would be hard to do on your hips. Or a pinpointed type of compression.
Speaking of which, Kathleen is asking to tell us a little bit more about trigger point massage. And yeah, and and then there's a follow up on the compression on the glute. But first, let's address this. Can you tell us about what is trigger point massage?
Ilana, do you want to go through your
I was going to have Olivia do it because she does mine. And
Go ahead, Ilana. Go on, talk about personal experience.
Olivia takes her elbow. No, so trigger point massage is basically when you identify a muscle that is tight, or in layman's terms, knotted. And you identify that area, and then it's a combination of, there's a couple different techniques, but a lot of trigger point is just kind of that pinpointed deep pressure to that area, and you hold it there for a while. And then there is actually some trigger point work that's done that's along cross fiber friction, which is you're massaging across the fibers of the muscle. I don't know.
Okay, so it's basically looking at the knots and like kind of, pushing them.
Yeah, so basically what you're doing is you're identifying a trigger point within a muscle. So as Ilana said, otherwise known as a knot. So it's a little tight area in a muscle, and basically you're focusing the massage. You're working to smooth out those knots. So it could be like tight, like lengthening strokes. We use a lot of elbows and forearms in our office. You can do like a pin and stretch would be one. So pinning the area, I'm just demonstrating on my neck, but pinning the area where the trigger point is, and then stretching the muscle underneath where I'm pinpointing. There are a couple of techniques there. Martin, did you have anything to add?
No, sorry.
Did we lose Martin?
We probably lost him. So on the Normatec stuff, I'm going to give my perspective on this, and I'm not entirely an expert, and I'm not, but I'm an enthusiast. So here's my take, and this is my hot take, and you guys can fight me. The Normatec stuff, what's nice about the compression is that it's moving around. So if you can't get a massage, that helps because it kind of massages the muscle, and that really helps with the release. as far as I know, in terms of the compression also helps with inflammation, right? This is you probably heard about RICE, right? Rest, ice, compression, elevation. That's what you do when you have kind of muscle that is inflamed. As far as treating pain, especially in deep areas like the hip, wearing a compression pants, for instance, is not going to help, right? There's that being said, it's a completely different thing. Is that I know that I enjoy wearing compression pants after like a run that was a little bit hard, right? But probably because of the inflammation. But when it comes to things that are a little bit more pinpointed like this, my understanding is that this is where you need something that is a lot more focused, like we were talking about the knot massages, right? Or to some extent, the type of stuff that Normatec is doing because it's moving around. But compression as compression pants and etc. is not going to be going deep enough. Is that a fair assessment?
Yeah, absolutely. I mean, compression isn't going to address any trigger points or any tight areas in the muscle that you might have.
Right.
Basically.
So
you would need that one step further.
So and Abby and Kathleen, does that make sense to you guys? Those answers, does that answer your question?
Yes, thank you.
Cool. Just making sure that we were addressing what was asked. All right. And I passed on the hip, then it just got the pants. Yeah, you probably. Yeah, I mean, Normatec is expensive enough, you know what I mean? So I'm with you. I'm with you on this. Fair enough. Anybody else has any other questions? So now I cannot sit anymore. Like I feel like my glute is not engaged, and like I'm gonna go spend an hour just doing freaking hip work.
Doing donkey cakes.
Right. Clamshell.
Just like there's that what is it, 30-day squat challenge, we should start a 30-day donkey cake challenge of building up to an hour straight.
That sounds rough. And then I'll actually I can share the link with you now, but our self-care series this week was on the hip, but we also have yeah. No, I mean like our blog series, I mean, is what I meant. So I'm going to copy that link into the chat box now. And you would have seen it in the email that went out when you registered for the mailing list. But we also have a ton of other great material on our website. So if you just go to our resources page and just type in a muscle area or a particular stretch you're looking for, then anything related will come up. But we do have a ton of great material, and what I showed you before was just the tip of the iceberg. So
yeah, if we have a little bit more free time, we also have available to you guys like some courses. So first of all, the self-care series. So if you go to courses.philomassages.com, you'll have access to these courses, and you also have access to a lot of cool stuff like workshop that you can do at home, like learn how to recovery and self massage techniques. So check this out as well. As we unfortunately can't come to you directly, we will trying to give you some resources to stay healthy.
Right. And if you did want further information, if you wanted to have a one-on-one consultation with us, you can book that online. Your first consultation's free through the remainder of the closure. And so it'll just be like a little personal question and answers with self-care tips and demos. So that's another thing you can do.
The good news is I don't take appointments because I don't know what I'm talking about. But the guys here know what they're doing. And, if you have something that you're wondering about or something that's bothering you, chances are we have something that we can give you that can help with whatever you're feeling. So, yep. Now that we are all Zoom masters, you know what I mean?
It's a learning process, right? Getting there. Although Martin disappeared, he never came back. So.
Yeah.
All right. So does anyone have any other questions for us? All right. Well, thank you very much for being here. Again, this was recorded, so it'll be posted on our website tomorrow. And then our next self-care series is going to be on the feet. So it's called A Look Into Your Soul. So look out for that starting Monday. And we hope to see you here again next week.
All right.
Oh, here he is. Hi, Martin. You made it back.
Yeah.
I thought I was connected the whole time, and you just told me that I left, and I thought I was here the whole time.
No, you came back right away.
He came back, he was just muted.
Just muted.
Oh. Maybe it's better.
Thanks all for joining, and we'll see you next week.
All right. Thanks, everybody.
Thank you.
Thanks, guys.
Thank you so much.
Bye, Mom. Thanks for joining.
Work on my psoas muscle.
Okay.
Thank you.